It was like the world's worst hangover for 9 months, from the moment I peed on the stick until after I gave birth.
The idea of losing weight when you are growing a human kind of blows my mind a little bit.
I think every single person with hyperemesis that I've looked after had carried that guilt. The mental side of it isn't spoken about enough.
Some days it was genuinely so bad, I just felt like I was dying.
We recognise it and we identify it and we manage it. We don't have to wait for the terrible things to start happening.
Before we get started, if I could just ask you a very quick favour, wherever you're watching or listening, if you could press follow or subscribe, that would be amazing. It makes a huge difference and will really help me get the message out to more women who really need it. Thank you so much and enjoy the episode.
Hello and welcome to this episode of Too Much Information. Today we are talking all about sickness during pregnancy, and specifically, and this is the big moment that I've been waiting for, Hyperemesis gravidarum. Have I said that right?
You have, well done.
That's great. So Hyperemesis gravidarum, aka HG, what it is, why it is not just bad morning sickness, and most importantly, what you can do from one woman who knows intimately what this is like, and two women who have seen and supported a lot of others through it. So first of all, the biggest thank you to the person who's made this all happen, who is Ella. Ella DM'd me on Instagram, literally messaged to say, "Hi, have you considered doing an episode on HG?" My response was, "What's HG?" And then when we spoke on the phone, it just struck me that you are the perfect person because you're a talker, you're a sharer, and you are so passionate about this topic. Ella, I would love you to tell us a little bit just about yourself, aside from the HG.
Well, thank you. That's very kind. I'm Ella. I'm 28 and a mum of 4 small children, including my twins who are 3 months old, and they were the HG pregnancy. I'm super passionate about all things women's health like you. I teach parents how to use baby carriers and slings safely as my job. So all of my life is very much focused on babies, parents, that kind of thing.
I love that.
Are we going to have a time to hear the story about how you found out you were expecting twins as the number 3 pregnancy?
Yeah, I mean, we always wanted a big family, but we thought we maybe would have to stop at 2, and then our circumstances changed. So we were like, oh yeah, 1 more, that sounds great. And then it ended up being twins. We just went for an early scan. I'll never forget it because the sonographer just was quiet, which is obviously a bit concerning. And then he just went, "So I'm seeing 2 babies and 2 heartbeats." And I think I just looked at my husband and he just started laughing. Like his initial reaction was just excitement. I was more shocked. I wouldn't have it any other way now.
My husband's an identical twin.
Yeah.
So I don't know, twins feel like this mystical thing sometimes.
Yeah.
And then you meet one and then you marry one and you're like, oh, they're not that weird.
Yeah.
And then today we have got 2 experts in the room. First of all, big welcome back to Sarah Cartwright, who appeared on our first episode of this podcast. Sarah's an NHS midwife and co-founder of Maya. Sarah, can you remind us what your work at Maya involves, please?
Thanks for having me back, Is. We've recently launched our online coaching platform, Maya, built by myself, a midwife, and my close friend who is a women's health coach, Tori. She specializes in TTC, antenatal and postnatal online coaching. So we basically have just built this platform to help educate and to support people in training throughout their pregnancy and after pregnancy in a really safe way.
So important and just so needed. So thank you so much for being here today.
Absolutely, my pleasure.
So if anyone's listening and they haven't listened to that one, which was all about childbirth, Sarah was incredible in that and had some brilliant advice. So Dr Lizemarie Wium, Sarah messaged me and just said, you need Liz on your podcast. She is the expert in HG, but I would love you to tell us a little bit about what you do and how you got there.
I have a really cool job. I'm a medical consultant, so I trained to look after people, men and women with medical conditions. but then I've subspecialized in the care of pregnant women with medical conditions, and it's absolutely fascinating. So talking to women who are planning a pregnancy, who have a background of something like chronic kidney disease or arthritis or heart conditions, how's the pregnancy going to affect those conditions, and how are these conditions going to affect the pregnancy? And then Sarah and I look after women with complex medical conditions in pregnancy, where Sarah is the maternal medicine midwife, I'm the obstetric physician. And then the part I quite enjoy is those women who've then had a medically complicated pregnancy, make sure they're on track, because often it's such a massive change in your life. They go home and their focus is on the baby, but thinking of mum as well. So a really, really, really interesting job, really fascinating. And yeah, every day is different. So that's great.
Like, honestly, this is probably the topic that I know the least about. And the crazy thing is that I've had 2 colleagues last week who, without even knowing that this was happening, one of them said, oh, I had this thing called HG during my pregnancy and it was horrendous. And then today I've had voice notes from 2 friends saying that either they or one of their sister-in-laws had this throughout multiple pregnancies. So the first question that I have is, what causes sickness during pregnancy?
It's your pesky hormones. Our hormones, as you are well aware and will probably continue to find out on this podcast, is they are the drivers of everything, essentially. So you've got your main players, you've got progesterone and estrogen, which are big players in pregnancy. And it's estrogen that we believe is more linked to kind of the feeling unwell, feeling sick. Progesterone relaxes all the smooth muscles, including your smooth muscles kind of at the sphincter and top of your tummy. And so that's what causes the kind of the acid reflux, the horrible burny stuff. And so that is kind of some of the drivers of the sickness. Other drivers are the hormone HCG. So raised levels during pregnancy cause the feeling of sickness, nausea. And then recent research has also showed the gene GDF15, which is linked to HG and general pregnancy sickness.
So is that why some people do get it and some people don't?
Yes.
Yeah, I think on the HCG thing, what I want to add is that's why Ella probably, or one of the reasons why she might have had it in a twin pregnancy of hers, because the higher the levels of HCG, the more common it is to struggle with hyperemesis. And women with molar pregnancies that have massive amounts of HCG often have really bad severe vomiting.
You've just said something there which is another term that was brand new to me this week, which is a molar pregnancy. What is a molar pregnancy?
Molar pregnancy is where there's no fetal bits. It's essentially where there's just placenta, lots and lots and lots and lots of placenta, but no fetus develops.
Doesn't continue to a viable pregnancy.
Thank you.
Cool.
And if you are going to feel sick during a pregnancy, how often does it happen and when does it normally happen?
I would say most commonly you feel sick more towards the beginning of your pregnancy. So the first trimester, especially. In my role as an NHS midwife, I see a lot of people who experience sickness normally between kind of 6 and 12 weeks, with it peaking generally between kind of weeks 8 and 10. And for the majority of people, thankfully, who experience pregnancy sickness, it does kind of stop around 12 to 14. It's not kind of that you wake up on the morning of your 12th week and you're like, I'm cured, I feel fantastic. It's really individual for everybody. And it's also, I think, rumour, and I think it actually does pregnancy sickness a big disservice by the fact that it's most commonly referred to as morning sickness, because it definitely is something that doesn't just happen in the morning. Sometimes it's slightly more common that people feel very nauseous first thing when they first wake up and haven't eaten anything, but the nausea can last the whole day. And a lot of people do actually suffer from it in the evening, especially when they're tired.
When we get to HG, what is it?
Like Sarah said, up to 80% of women can have some form of sickness in their pregnancy. but hyperemesis really happens to about 0.3 to 3.6% of all women, all pregnancies. In 2021, they brought out the international definition for hyperemesis, which is 4 things which I write down and I need to read again. So symptoms have to start early in pregnancy, before 16 weeks gestation. If it happens after that, we have to question, this is probably not hyperemesis, there must be something else causing it. Nausea and vomiting, of which one of the 2 is more severe. So some women vomit more and don't feel that sick, and many women feel extremely sick but they don't vomit, and I think they weren't getting the recognition that they needed because they didn't vomit that much, so they didn't dehydrate that much, but they felt absolutely awful throughout. An inability to eat or drink normally, and symptoms that strongly limit their daily activities. So that's our international definition, those 4 things. If you have that, we call it hyperemesis gravidarum. And I just think that that's so important, because instead of waiting for ketones to happen or waiting for the weight loss to happen, we recognize it and we identify it and we manage it. We don't have to wait for the terrible things to start happening.
Yeah. And I even was listening to another podcast recently, and they said that they think they may have found something which can actually start to not cure, but almost prevent this from happening if women know about it in advance, which seems kind of impossible.
There's one tablet that we like quite a lot called Zonvia. It's really expensive, and we use it. Ella, were you on Zonvia?
I could not access Zonvia in my trust. So I had that barrier of, here's this drug, you can't have it, basically.
Yeah, that's really frustrating. It's expensive, and it's a lot more expensive than other antiemetics. And so it's taken time to introduce it. Many pharmacies didn't stock it, and most GPs don't have any access to it. The national guidance changed last year, and they bumped it up to frontline or first-line treatment, and that's made it more accessible. It's a pity that you didn't have access to it, but
it was not something the GP or the doctors in my hospital could prescribe. They looked into it, but it just, there was no access, and it was a case of, I can't afford to go and seek it privately, so I didn't get to take it.
It does seem to make a massive difference, but every person is individual.
Yeah, I agree, and I definitely think for some people it's like night and day, especially for people that have had HD in a previous pregnancy and then have got it again in a subsequent pregnancy, have started it and have it's an amazing thing that we can now do, but I wish it was 100% and it was transformative for every single person. But I would say the large majority of people, it does make a difference, which is incredible, if not a little too late.
And other than that drug, are there other medications which are available and safe, crucially, for people who have HD?
That's such a good question, because I think one of the things that curses hyperemesis or just pregnancy sickness is that thalidomide scandal from the 1950s, where a drug was prescribed for women with sickness, and those who took it before 12 weeks ended up with disastrous pregnancy outcomes. And I think that's made all of us so careful. And why many people just stay away from prescribing in pregnancy. So the national guidance has really revolutionized the way we manage hyperemesis and pregnancy sickness. It's a tiered approach. With our first tier is our antihistamines. And Ella, what were you on? Were you on cyclizine?
Yeah, that was my first one that I tried.
That's the first one. That's the one that we use the most. It's the most available. It's cheap and it's safe to use. We've got lots of safety data on it. So I think that's the one that we start everyone on with sickness. And then we've got a bunch of other antihistamines, prochlorperazine. Some women quite like the one that you put in your cheek. Ella, which
I did try that one as well, actually. I think I'd had both, because swallowing tablets when you have hyperemesis is a total nightmare. The dissolvable was easier.
So a bunch of antihistamines that can make you quite drowsy, but they're absolutely safe to use. And we build it up. So once we've got someone on 2 of those agents, we go to our second line, and this is where we come in with metoclopramide and or ondansetron and or domperidone. And a couple of years ago, there was a big outroar about ondansetron not being safe, and they were worried about cleft lip and palate if it was started in the first trimester.
I had this I had this because I took ondansetron and had pharmacists getting muddled about whether it was safe
Yes.
to prescribe or not. And then I got
Yes.
stressed. So yeah, I had that experience as well.
Now, the data is controversial, but the biggest data set that we've got where they compared the risk of cleft lip and palate to the general population to women who've been exposed to ondansetron. The background risk of cleft lip and palate is about 11 per 10,000 deliveries. And the incidence of cleft lip and palate in women exposed to ondansetron is about 14 per 10,000, meaning it increases your risk by 0.003%. So it's statistically significant, but it's not clinically significant.
Yeah.
And Sarah, I think you'll agree, of the drugs that women say work best for them, ondansetron is almost the strongest one. It begs the question whether it's really the drug that causes it or the nutritional deficiencies that happen when a woman is vomiting profusely and continuously throughout her pregnancy, and whether that leads to these structural abnormalities or whether it's really the drug that causes it. Now, the jury's out on that. My very good friend who wrote the national guidance, she's writing her PhD on the micronutrient deficiency. So keep an eye out for that, because that's going to be really, really interesting to see. The third level of treatment, actually, I just almost forgot about that. So once we maxed out on antiemetics, the next thing to go to is steroids. And again, a lot of controversy about steroids and wondering whether it's safe or not safe. It causes havoc with the mom's physiology. It often causes gestational diabetes and can make the babies grow quite large. All sorts of other complications from steroids can also happen. So it's really not something that we want to keep people on. But in women who've got debilitating hyperemesis, this really does make a difference. We try really, really hard to avoid it, but we do put it on if it's necessary. Not because we're worried about the effects, but just because of all the other side effects of steroids.
It's also really personal. And, even what works for one person at one stage in their pregnancy might work differently at a different stage. People come to me and they say, yeah, I was prescribed this, but I've stopped taking it because it wasn't working. I really do encourage them. I think it's important to be aware that, okay, let's try that again and let's see how that works. And I would say more often than not, actually on return to that drug or with that drug in combination with another drug at a certain time of day, that can also help. It's not just about the drugs, it's about the combination, where you're at in your pregnancy, and even, like I said, the time of day that you're taking it, whether you're taking it with food, without food, it is really dependent.
Ella, what was your experience?
I didn't have steroids, so I started on cyclizine, and the other one that you mentioned that I can't pronounce begins with the P. So I kind of went up the ladder a little bit. I had one sort of instance of being dehydrated as well, where I went into maternity assessment at 14 weeks. They gave me fluids in a drip, and they gave me an injection of ondansetron. So that was quite fast acting, because I'd gotten to a point where I couldn't keep anything down, and they were fantastic. They took really, really good care of me. And that helped enough for me to go home, and still struggled a lot, but and then it was ondansetron for me.
Right.
I don't think I never stopped feeling sick, but it was the best that I tried. But I got to a point where I just I did give up a bit on treatment. So I wasn't really taking it super consistently. I didn't push for anything else because I was struggling so much. So it definitely wasn't curative for me.
Yeah. Gosh. Constipation?
No.
Oh, lucky. Lucky. I think lots of women who listen to this might say the constipation is quite rough on the
From ondansetron. Yeah, they'd warned me, but not
Oh, lucky. Me. Well, what a small mercy.
Small wins, we will take them.
Yeah. And I like that you bring in that IV fluids and IV antiemetics is also part of it. Sometimes we have to admit people and get them onto intravenous stuff and just get a grip on it, calm it down, and then switch back onto orals and get them back out. A new trend that really makes a difference is to arrange at-home care where we get fluids and anti-sickness medication given to women at home. It really makes a massive
I've heard
difference.
about it at King's. I was like, ooh, that sounds amazing. I would have loved this.
Because especially if you've got children already at home. I mean, it's one thing for, a pregnant person where it's their first time pregnancy to be in and out of hospital or staying there for a period of time, but in your situation, Ella, where you've got 2 little ones already at home, that's just not, it's not possible.
No, it was one of the things that I found the most difficult about my experience was that I, one, had to parent, and two, you can't take children with you to scans or appointments or anything, actually. If I could have had medicine like that at home, that would have been transformational. So I'm really pleased to see that that's something that's coming in now, and hopefully that can be, you know, increased elsewhere as well.
Other women.
Yeah. I think I'm painting a picture right now of the risks to mum and baby. We're talking about not being able to eat properly, not being able to drink water, and potentially losing weight, which in my mind, the idea of losing weight when you are growing a human just kind of blows my mind a little bit.
Yeah.
But what are the risks? And I actually am more interested in what the risks are to the mum as well, because you know, Ella, you've touched on mental health as well, and I think that's something we absolutely need to go into, because this is so much more than just what is skin deep.
Yeah, absolutely. Fetal effects. There's some evidence that shows that babies can grow small for gestational age. And in very, very, very severe cases where mum's got really severe nutritional deficiencies, it can cause an increased tendency to bleed and can affect the baby's brain through that. But that's really rare, so let's not focus on that. I like that you say the mum. And the one thing that we're really scared of is blood clots, because women dehydrate and they are far more prone, 2.5 times as likely as someone who hasn't got it, to get blood clots. So this is really a reason to go seek help. If you cannot control your vomiting, get to the hospital so we can get your sickness under control, but we can also get some blood thinners into you, because when it's really severe, we need to get blood thinners in.
Blood clots, is there a warning sign where someone really needs to go to a hospital now?
Yeah, I guess pain. So we look for blood clots in the legs, but it's the blood clots that shoot off to the lungs that I'm worried about. So if you're more breathless than you used to be, and you've got chest pain that you can't explain, that doesn't go away with paracetamol, go have it checked out. Another thing I'm worried about is the electrolyte abnormalities. So people, just sodium goes haywire. You vomit out all your potassium, that goes haywire. Chloride's going to come out, calcium, magnesium. So that's also something that needs controlling. But I think of everything, the blood clots is the one that causes the most trouble.
Ella, are you ready?
Yes.
Treat this as much of a therapy session as you need to. From the start, how was this pregnancy different?
Well, it was very different. I mean, partly just because it was twins. But I pretty much knew I was pregnant before testing, just based on my boobs mostly. That's always the thing that told me. But I felt sick straight away, like instantly straight away. I took the test and it was very dark. The line was very dark, which in hindsight I now understand to be because there were 2 babies in there. I actually was in kind of disbelief, because I thought, well, I can't be feeling that sick yet, because a lot of things say that sickness starts a bit late, like not instantly. For me, it was straight away, and it pretty much carried on throughout the entire pregnancy. There wasn't a day, I don't think, that I didn't feel nauseous. So I was one of the people who the nausea was really, really severe, and I did vomit, but it wasn't as bad as some women who I've heard of, you know, vomiting constantly. There were days where I maybe would be sick once, or I think there were a couple where I wasn't, but the nausea was debilitating just the whole way through. And it's tricky, because I think as women, we're just taught, aren't we, to carry on and to soldier through. I had children to take care of. I had a job. I had a busy life. And I thought, well, it's twins. Of course I'm going to feel more sick. It's twins. Because I found out early on that it was twins. So I knew from, I think, about 7 weeks, and that there were 2 babies. And so I think that actually delayed my seeking help a bit, because I just assumed this is twin pregnancy. And I have a friend and a colleague who is a twin mum, and she didn't get any sickness really at all. And so I remember talking to her about that after all this and thinking, okay, so maybe it wasn't just twins. And I only really sought help because there was a feature on the news around the time that I was struggling about HG. And that actually kicked me into gear to go, okay, no, like this is actually bad and you are allowed to feel that way. And so you should go and seek some help. And so that's I think the first time I went to my GP about it, because one of the difficult things about HG is that a lot of women experience symptoms before they've even had their booking appointment with their midwife. I think that's around 8 weeks normally. And with twins, so with my trust, you have a twin specific midwife, but you don't see them until I think it was 16 weeks. I saw them and the doctor. And actually, a lot of my struggles had been before then. And it did feel a little bit like there was nowhere for me to go. It was like, I don't fit here. I've not even been booked yet. So it's almost like up until that point, it doesn't even really feel like you're pregnant, especially if you've not had the privilege like I had to have and pay for an early scan. That makes it harder, I think, because you're just struggling so much, but you've not really had that point of contact with somebody who can explain why and what your options are. And when I went to the GP initially, I'm not sure who it was. I know that they weren't a GP. They were some kind of practitioner who clearly just had absolutely no idea. And they did prescribe me some medicine, which was good, but I was not heard. And so I went into myself a bit more because I just didn't feel validated. I felt like I was maybe just making too much of a fuss. I don't know. It's just, I think every woman will relate to that with other things. Just that gaslighting yourself into thinking, I'm fine. Let me just carry on. It'll be okay. So that was kind of the beginning.
What I have a lot to say about the whole waiting for 12 weeks until you're allowed to tell people anyway. How can you is there anything you can compare this to in terms of how you were physically feeling?
I think the one I try and say to people, and it may not be for everybody else, for me it was kind of like the world's worst hangover, but for 9 months. And I'm talking like a bad one. Just 24/7 nausea. So I felt some level of sick the entire time, from the moment I peed on the stick, before then even, until after I gave birth. Some days it was genuinely so bad I just felt like I was dying. Like I said to my husband, I can't actually exist. This is so horrific and so debilitating. And I was parenting from the bathroom floor, feeling so sick, having to order takeaway to feed my children because I couldn't get up and cook them a meal. Even sounds made me nauseous, everything. So there were days where I was like, and I'm not even exaggerating, crawling around on the floor. And I'd laugh about this now and it wasn't funny at the time, but it's things like wiping a bum and then being sick. I remember texting my friends about that, like, I've hit a new low today. The guilt of not being able to be there for my children. And they remember, they say, if I ever say now that I feel a bit poorly, they say, oh, are there babies in your tummy again? Because they remember what that was like. And my little girl will role play being sick as part of pretending to be pregnant. So yeah, a lot of vomiting, a lot of nausea. And then I could eat, but it was very variable. So I could only really eat whatever I was very specifically craving at the time. And there was often very plain, potato waffles pretty much grew these twins.
Yeah. Good choice.
Yeah, because they can go in the toaster, so it's easy to make when you can't.
Yeah.
Even I couldn't even drink water unless it was ice cold. To the point my husband started freezing like massive bags, literally bags of ice, and just smashing it up because it was better than like an ice cube tray.
Him.
And Coca-Cola, I think partly because my mum used to give us that when we had tummy bugs as kids, so it was like a comfort. It ruins your relationship with food, for me anyway. And I am a foodie. I love to cook. I couldn't even I'd have to unfollow like Instagram accounts that would post recipes and food because I couldn't look at it. Literally, even just being in a supermarket or looking at a picture of food was hard. And instead of enjoying food, it was, I need to eat because I need to survive. And that was it. And also that was really hard.
You need to eat because you need to survive, but you've also got not one, but two other lives depending on you too. It's a lot.
It was a lot. It's why I'm here, because I just need people to hear about it, because so many people don't really understand the severity of it. I also got a lot of headaches, just I guess because I was dehydrated. I also had, I think there's a name for it, but excess saliva in my mouth.
Tylerism.
Yeah.
Tylerism. Yeah.
That's what I associate with that feeling when I feel like I'm going to be sick
Yeah.
or just before you are. It is that excess saliva.
Yeah.
I feel like it kind of floods your mouth and it goes a bit tingly and it
Ugh.
tastes a specific way. And that's when I'm like, I need to get to a loo now.
Yeah.
So all I'm trying to picture is that for 9 months.
Yeah.
And it sounds like a living hell.
It was. And yeah, I had excess saliva, so I was having to like spit into like a bowl or something like that.
With a cup or something you carried with you.
Yeah.
Yeah.
For a while I had metallic taste in my mouth as well.
I'm just so glad you're talking about it. You got dismissed quite a bit, and I think a lot of women say that. And talking about it and other women hearing about it and knowing where to go. This is a bit where I can say about that website that I like so much. The pregnancy sickness support website. Recommend anyone who's struggling, even with just a bit of sickness, to go look on this website and go read about drug safety and go connect with the larger community. And on there, it's got the national guidance as well. And I think if someone can walk in with that in their hand and go to that GP's assistant, it was probably a physician's assistant who you saw, and say, here's the national guidance, I feel awful, can you help me? It's very different to just hoping they recognize you.
Yeah, I did that in the end. I can't remember initially how I discovered pregnancy sickness support, but I found them and I contacted them through WhatsApp. Which is exactly what you need when you're feeling really poorly. I didn't even really want to be on the phone. They send like almost a script essentially to give to them. I was also very lucky that when I went back to the GP that I had a very lovely female doctor who clearly knew more about it than the previous person that I'd seen. And she took me very, very seriously and helped. Some of my memories are it was such a horrible time. I volunteer with pregnancy sickness support now. And some of what they do is trying to make sure that women know where they can go, how they can access this, so that pregnant people aren't left in the dark about the services in their area and whether there's an early pregnancy unit or a maternity assessment, how many weeks you need to be, that kind of thing. Because again, when you're that sick, you're not thinking about researching all of this. You just want a really nice, easy answer to that. And there's a few things that the charity do. One of them is also peer support. So I had peer support, and it's on WhatsApp, and it's someone who's lived the experience and is now at the other side. And you can just talk to them and just have someone who actually understands it. It's absolutely fantastic. They also gave me counselling. So I had like HG specific therapy, basically, which was just invaluable because I think it needs to be specific to the experience. And I think a lot of women do come out of HG and deliver their babies, and they don't really want to talk about it or revisit it again because it's a concentrated experience, but I think it stays with you for forever. And once you are made to feel like it's just a pregnancy issue, and almost that makes it less severe somehow. They just go, well, it'll go away when you have your baby. It's like, well, okay, that's not helping me right
9
now.
months of my life.
Yeah, absolutely.
It's just, I mean, we will definitely be signposting them in the notes as well, because it just sounds like they do incredible work. But I'd love to know, Ella, how did you actually cope day to day? What worked for you?
Well, I think it was just like a day at a time. I had to. And a lot of the time I would also argue that I wasn't coping. There were points at which I definitely did not cope. But as a whole, I think we got into a little bit of a routine of how I would manage to leave the house. So just sick bags everywhere. I still find them like around my house, and they're everywhere.
Yeah,
I think my husband just ordered like 100 on Amazon one day, and we just put them everywhere in the car. Like I literally had to put them strategically because it was like, I'm going to be reaching for these. Help from other people. I just asked everyone I knew, can you come and help me parent my kids? Can you babysit my kids? Can you feed my kids? Because I can't be around food today. A lot of support from other people. I was also quite lucky. My employer, I work for Sling Library, it's a very small business, and it means my wonderful manager Nicola, she got it, she understood, like she was great. So I was very lucky to work for somewhere that also I could be off, or I could be sat down and modify my work. There was always a can of Coke in the fridge for me at work, you know, that kind of thing.
Oh, sweet.
I had loads of support in that department. A lot of people obviously do not have this. And even with my husband, because there were times where he needed to be off work because I was so ill, I couldn't physically look after my kids. And it's hard because I think he had to do a lot of explaining to get people to understand, because it wasn't just like, oh, your wife's got a bit of morning sickness and you're off work. It was like, no, this is pretty bad. I think once I'd been in hospital, he would say that because people would understand. But it was really hard because there's no type of leave for you to take. And there were times where we would have to decide, well, do I really struggle, or are you going to be off work and then we're not going to have the money that we need, you know? And financially we took a big hit and we just had to do what we could, really. Ice cold water, ice lollies, that kind of thing did help. Ice lollies, actually, somebody reminded me of that, and I was like, I just lived off ice lollies for a while as well. And just using that peer support, going to that counselling, so knowing you've got support was making it easier to get through every day. But it was very, very difficult.
Something that I see a lot is women coming in and talking about the struggle that they have physically, but also that kind of feeling like, oh, I shouldn't be this sick. I think every single person with hyperemesis I've looked after has carried that guilt for not being the friend, the wife, the girlfriend, the whoever to the people around them. I definitely think that the mental side of it isn't spoken about enough, and actually the toll and how triggering and traumatic, you know, even getting sick when you're not pregnant is, because it all just comes flooding back. And I'm so glad to hear that you received mental health support during your pregnancy, but it's definitely something that we need to do better at.
You're absolutely right, Sarah. Like the guilt I felt, I mean, mostly as a mum, because I had 2 small kids who couldn't understand. They were not old enough to understand. And you're just expected to just get on with it, really. And I also think and people would kind of tire hearing about it a little bit. I think they expect you to get better. So I had a lot of, oh, but you're this many weeks now. Are you still being sick?
Should have lifted by now.
Are you sure? Oh, have you tried ginger? Have you tried a cracker? Have you tried this? I was like, yeah, of course I have. I've tried literally everything. And why would I not have done, you know? And I know people mean really well, but it's exhausting to also carry the burden of having to educate everyone around you on your own experience whilst you're still feeling like you are. I think, Sarah, you said it, traumatic, and it is trauma. It's not recognised as such, but it should be. It is absolutely traumatic. And I think just because, again, it's a pregnancy-specific issue, a women-specific issue, it's under-researched, under everything, not talked about enough. And it's just that thing of, oh, but I haven't been sick today. Does that mean actually I no longer have this? And my experience isn't as bad as the other person who I've heard who was being sick 30 times a day. It's a lot of that as well, which doesn't help anybody. Because if you're suffering, you're suffering. And even if you just feel really, really sick and you're being sick once or twice, it's still horrible.
I think also we as women have kind of been conditioned to just deal with these things.
Yeah.
Particularly if they are women's health issues, you suffer in silence and you keep trucking on and you don't make a big deal out of it because it's a bit gross and no one wants to hear about it.
Yeah.
And that in itself needs to change.
Yeah.
But it's not our fault. It's not our fault that we feel that way. It's more that it's okay to miss the party and to just not be able to show up because all you're focusing on is just keeping yourself alive, let alone growing a human or two.
And for me as well, I know earlier you mentioned about the whole not telling people you're pregnant until 12 weeks thing. In this pregnancy, I truly had no choice. I actually, there were some friends I literally just texted and be like, right, hi, so yeah, I'm pregnant, I feel like I'm dying, can you help? And that was, I had to do that. And it took the joy out of some of it, because it was like, I'm telling you this because I'm not coping.
I have a crisis.
And I need you to help me.
I know that this was your 3rd pregnancy with twins.
Yeah.
But would this experience put you off having another child?
Yeah, so I know I was very glad that this was probably is my last pregnancy. Like don't intend to have any more children. I think it would 100% be a factor if it was, say it was my first pregnancy. But yeah, I mean, I think knowing you would have to go through that. I think people who have had multiple HG pregnancies are absolute warriors, because if I had known what was coming for me, I don't know if I could do that personally.
No. If I could add, my friend who's writing a PhD on this did a survey of 5,000 pregnancies, and up to 6% of women considered termination because it was so severe. So there's not just not planning another pregnancy, there's also those women who say, I can't carry on with this, and that absolute guilt of ending a pregnancy because you just couldn't cope. And I think we should recognize that and validate that and just say, that's how severe it gets. And so termination and suicide, where women say, I don't want to be alive anymore. It's so awful.
Yeah.
That's how serious it gets.
I genuinely, I wanted this pregnancy. I wanted the babies, but there were times where I thought, should I terminate? Because I can't, that crossed my mind 100%. I'd said it to my husband a couple of times, and I felt horrendous for thinking that, because I so wanted the babies. That's how severe it was. I hated every second of it, really. Every second. Like, I was like, I actually hate this. This is the worst thing. But then that's really tough, because obviously I was very grateful to be pregnant. I've had a miscarriage before in my past, so it was something I've had that feeling of loss, and so I knew how precious it was to be pregnant. I was under the support of the perinatal mental health team from about 19-20 weeks. I had pretty like a bit of a breakdown because I was just having a very rough time mentally. I never made any plans or anything, but I absolutely did feel suicidal at points during my pregnancy, because I could not see how I could physically go on. And there was a death sort of that's in the news, Jess and her baby Elsie that died, and they basically ruled that HG contributed to her death. It doesn't get enough mention a lot, that actually the mental side of it can be, I think, just as potentially dangerous as the physical side of it. So I just wanted to say that while we're here.
Thank you.
Thank you, Ella. That's so brave of you to talk about. And a lot of the time, I know when I've been Googling these things, so many of the top questions asked are about things like, will medication for HG harm my baby?
Yeah. Exactly.
And actually, I think you've raised such an important point here, which is that obviously with the right medication and under the right clinical support, that can help you. But maybe the thing that we're not thinking about is actually the unseen sides of this and how dangerous that could be to mum and baby as well. So thank you so much for talking about that.
And people said to me all the time, oh, but it'll be so worth it. That was a big thing people said to me. And I was like, well, you might be right, but this doesn't help me right now at all, because I am not coping right now. And my mental health really, really suffered from it really badly. So yeah, it's very tough. One of the things I struggled with as well was social media when you're pregnant. I felt really sad seeing people who were able to be active in pregnancy and who were posting exercise through pregnancy. And because I play football, and I tried to continue playing for night. There was absolutely no way. Once I got to the sickness, I could barely walk at points, and I felt very guilty and very low mentally because of mourning the life that I had a few months ago. And I was like, why have I done this to myself? I've lost all of my hobbies. I've lost the ability to enjoy anything, really.
There is obviously two sides to social media, and someone that you've said was a really positive influence on social media was Clarkson.
Yeah. Oh, I have so much to say about her. I knew about it very loosely before I had my HG pregnancy, but the person that 100% educated me on it was her. I followed her just because she's an awesome content creator anyway, but she had 2 HG pregnancies, and I thought her content was just incredibly raw, real. She didn't edit anything out. She just shared her whole experience. And when I did then experience it, I would revisit that content and use it to help me get through, just to feel seen. Little things like, I remember that she spoke about getting a new toilet because she was so traumatized by her toilet because she was being sick in it so often. And I was like, I just feel like that is so unbelievably relatable. And she was just a really good resource for me. Like you say, two sides of social media, but she educated me and just made me feel so much better. And I appreciate that she's posting about it to a lot of people and also getting probably a lot of criticism for what she's saying as well. When I saw like the photos she would post of herself, like, you know, looking really unwell and ghostly white, like I've got so many pictures of me like that. And to know that because of the timing of hers, she then was posting about surviving HG and enjoying life with her daughters and how amazing life after HG was, when I felt like I couldn't go on, I was like, okay, it does get better. I can see that. So, she's a wonderful, wonderful creator.
She'll get nothing but love from us.
Yeah.
No hate here. And how do you feel now, looking back on it, Ella?
It's very strange looking back because I don't really recognize myself when I think about it. It's quite hard to put myself back in that place because it was so rough and so horrible. I was trying to get through it and trying to stay positive because I've always been the kind of person who tries to find a positive side to everything. I think now my issue is that I think Sarah touched on this earlier, that if I feel even the slightest bit of nausea, it's like I've been thrown right back into that. And I start to panic. I get very, very distressed because it's like, no, I can't do this. I can't be here again. You know, to the point where, you know, I've actively avoided anything that I think could possibly make me feel sick. It's like I said to my husband, I'm not sure if I'll really be drinking and things like that because the idea of ever causing myself to feel sick again is just so repulsive to me. Yeah. Or if like one of my children seems like they might have a tummy bug, I'm like, no, I can't possibly do it. So,
wow.
Yeah, it's definitely something that will stay. I think it'll stay with me forever. I don't think it will fade, like the memories of it. But I think I said this to Issy, that whilst it's a kind of pregnancy specific condition, I think that the effects of it are lifelong. Even once you've given birth and it resolves, because that's, you know, what happens. I felt immediately not sick anymore. I remember the moment actually because my husband looked at me and he could see it.
And when was that?
Probably sort of 20 minutes, 30 minutes after they'd been born.
Oh my God, that instant.
Yeah, and I was sort of holding them, and the sickness I'd had after was, I think, just to do with like the adrenaline and
all
it was
of
quite
the
fast.
rush.
My twins were born. They were born 4 minutes apart, so it was a quick delivery. So it was just like, whoa, this has happened. But yeah, I was holding them, and he said that my face and my demeanor just changed, and he just looked at me and he just said, "You don't feel sick anymore, do you?" And I was like, "No." And then I got the tea and the toast, and it was the best experience of my life. Like, I know everybody raves about the tea and toast after you've given birth, and it is always good, but it was the best tea and toast of my life. Yeah, that's how quick it was for me.
Incredible.
And I remember
that is just...
I was in labour, and I said to my husband, I was like, I'm so excited to not feel sick anymore. Like, I'm excited to meet these babies. But actually, one of the things I was thinking about was how buzzing I was that the HG experience had finished. And I remember messaging the person who was doing my peer support. I literally just said to her, like, babies have been born, I feel better. And I don't actually think I said anything else because I was so overwhelmed, and I was like, I don't want to talk about it. I don't want to like think about it. I am not feeling sick anymore. This is done. And I ate all the food and it was great. But yeah, the elation after that low was something else.
Thank you so much for sharing all of that. Like, what an incredible but horrific story, but so real. And I don't think you could have painted a more vivid picture of all of it.
Ella, you're absolutely incredible. Like, honestly, you're amazing. I think it's so brave to come out and advocate and for others and speak about your experience when you went through something so acutely traumatic. So thank you. Thank you.
Yeah, what Sarah said. I agree.
I would like to finish off with a couple of listener questions. Somebody has said, or somebody has asked, if I'm very sick during my pregnancy, it means I'm having a girl.
I love
Absolute
that one.
rubbish.
I had 2 boys.
People attach so many random things to the gender of a baby.
So are we calling bullshit on the sickness meaning a girl?
Yeah, I think it's a load of rubbish.
I mean, if I Google it, the British Journal of Obstetrics and Gynecology says female fetuses are more associated with hyperemesis. So, yeah,
Interesting.
no.
Either way, it's not a helpful thing to say to somebody, is it? Like,
It's probably the least of your worries at that stage.
Yeah.
Okay. So other people have asked, will it happen again if it happened with my first?
Yeah, unfortunately, very likely.
Really?
It might skip pregnancies, but it might also happen.
I know
Yeah.
Pregnancy Sickness Support has all the statistics for this kind of thing on like recurrence and stuff on their website.
Oh, there we go. Yeah, tell us.
Okay.
Can you remember what they are?
I think it's 80-something% though, chance that you'll have it again.
Interesting. And then the counter part of that is, if I was fine with my first, does it mean that I'll be fine with future pregnancies? I mean, Ella, you're living
Yeah.
proof that that may not be the case.
No, although I think me having twins probably contributes
Yes.
there. So I'm not the best example of that case.
Yeah, it's the multifactorial part of it, where it can be an endocrine associated thing. So hormones can be where your thyroid hormone might be out, or it could be an infection in your stomach that's contributing to it. It could be a new partner where you have whole new genetics in the fetus. You know,
Yeah.
That's
it's not
interesting.
necessarily it's the long and short of it.
Okay. And I think the final myth that I would like to bust, well, there are a couple here. Eating ginger will cure
Nonsense. Absolute nonsense.
I tried so much ginger that I got like a really bad aversion to it, so it made it
And
worse.
that's the thing. There's so many women who say that. They feel dismissed because their aunties say, oh, just try some ginger.
try ginger.
But this is way more serious than just a bit of ginger.
Yeah.
So
Yeah.
absolute nonsense.
Yeah.
it. Okay. And then ketones in urine, if that's not present, can you still have HG?
Absolutely.
Yes.
Ketones
Yeah.
just mean that you're energy depleted, that you haven't eaten recently, or that you haven't got enough energy in your body at the moment, and it needs to break down some of the fats in your body to make energy. You don't have to wait that long. And both ways, the presence of it doesn't mean you have it, and the absence of it doesn't mean you haven't got it.
Okay.
Mm.
Brilliant. And then the final one, really important one, combining drugs is fine?
Absolutely. Because they work in different ways. They work on different receptors. The ondansetron works in the brain, the antihistamines work in the stomach. So that's almost the secret to managing hyperemesis, is hitting different receptors in different places. Some women like it all together, so they take their tablets 3 times a day in big clumps, and other women literally set alarms on their phone, and every 2 hours they take something else in 8-hour spaces. But to me, that's the biggest way of overcoming or getting a grip on the hyperemesis, is figuring out what works for who and which drugs works for who. But it has to be a combination.
Yeah, I got to that point where it was like, what
Did you?
cocktail of things is going to work for me and when? And I found actually first thing in the morning was the best time for me to take things.
Yeah.
And that was
Yeah.
kind of how I ended up doing it. But I know it's different for everybody.
Yeah.
My one final question for you all is just, if there is one thing that you want anyone who comes listening to this, who either has a friend who is suffering with sickness during pregnancy or who is going through it themselves, if there is one takeaway, what would you say that should be? Sarah, do you want to start us off?
It would be, there's no threshold that you have to meet. If you are sick in pregnancy and it is stopping you from being able to do what you feel like you should be able to do, it's never too early to get support, and actually getting the really early support is so important. To go early and to seek support in different places if you're not satisfied with it.
Thank you. Liz, do you want to go next?
I'm just going to be a medic, and I'm hoping Sarah and Ella will do the the holistic parts of it. I'm going to just be a medic and say blood clots. That's my biggest concern. And one thing we didn't talk about was if they have other conditions, epilepsy, HIV, depression, where they can't take their medication because they're vomiting so much, get help so we can get a grip on your diseases.
That's really, really, really practical advice. Last but not least, Ella, what about you?
To anyone, I would say, who's going through it, if you're going through hell, keep walking. You can get through it. There is a life after HG. I know that's not always helpful in the moment, but just keep going.
Thank you so much for your openness, for so many incredible facts, and most of all, Ella, just for bringing this to life in a way that I think is so needed and will genuinely help a lot of women. And I hope you're really proud of yourself, honestly.
Thank you. I don't think I could have envisioned myself doing this when I was in it, so I'm glad that something positive has come from that. I'd like it to be something that everybody knows what it is.
Yeah, absolutely. Yeah.
I know that this will make a difference, so I really appreciate it hugely.
No worries.
Thanks, Issy. Thanks for giving
Thanks,
it.
Issy.
Yeah, thanks for giving me the platform to
guys.
talk about it.
Yeah,
Absolutely.
My pleasure,
lovely.
honestly.